The vast majority of children and young athletes are going to do very well with COVID, and majority will not have long-term complications or issues. However, we know that even patients who were seemingly asymptomatic or minimally symptomatic can have some important complications specifically related to the heart that really need to be looked at closely. Again, it's important to realize that we're talking about a minority of patients here, but seeing your primary care physician, seeing sports medicine, or sometimes even cardiology is really going to be the safest course for most patients.
So when you see your pediatrician, they may just evaluate you for signs and symptoms and say we can gradually work back into sports. But if you had any fever, and that's a temperature of 100.4 or higher, then we're more concerned that there may be effects on the heart. And so those specifically need to be actually seen by your primary care doctor, and they may be doing some further testing after that.
When it's time to kind of end that period of rest and think about getting back into sports, if your child is having ongoing issues with, say, palpitations, chest pain, especially with activity or the initiation of activity, certainly lightheadedness, feeling like they're going to pass out, I think that's stuff that absolutely needs an evaluation and absolutely needs to be thought about in depth. Many times, starting with the primary care physician or sports medicine is a reasonable course, but also many times that primary care physician may need help in assessing the significance or the severity of that.
Athletes usually are able to bounce back from illness pretty quickly, but sometimes when an athlete comes back from COVID, we're noticing that they're short of breath for longer, or it's harder for them to get back into sport as easily. Some of them are having chest pain. We're having some athletes who are actually passing out because they're getting back into sport and their heart is inflamed. If you have any concerns about your athlete just not seeming to be as conditioned as usual, not in as good a shape as you would expect them to be after this illness, those are major concerns. But even kids who feel nothing with the COVID infection should at least check in with their doctor and make sure that everything is okay.